For my first slide, I had characters of individuals with hearing impairments. And the first part it talks about is intelligence. And so research tells us that on the intellectual characteristics of kids with hearing impairments, they've suggested that the distribution of intelligence, or the IQ scores for these individuals, is similar to that of their hearing counterparts. So any difficulties that intellectual development has for people with hearing impairment is more of a function of language development than cognitive ability. And any difficulties in this performance appear to be closely associated with speaking, reading, and writing the English language, but is unrelated to the level of intelligence. And with speech and language, these skills are the areas of development that is most severely affected for those with a hearing impairment, particularly for those children who are born deaf. And many of these children who are born deaf typically have a very difficult time learning to use speech. And it also depends on how profound the hearing loss is. So if it is mild, it's not as bad, but when you get into moderate and severe, it can be very difficult for a child to develop speech and language. And there's also this new device called cochlear implants that attaches to the child's ear and brain, so they are able to hear a little bit better. And social interaction, this can be a little bit difficult. If they're not around other children who, let's say, don't know sign language or they can't understand it, it's hard for these kids to interact with one another because of the language barrier. What they can do is they can teach their sign language to their classmates or their friends. The teacher can. They can implement a little section of their day to help the child feel more welcome. And it can also hinder their growth as well if they aren't interacting with other kids. But if there are other children who have the same hearing loss as them, then it can be a little bit more difficult. And so with the educational achievement, since if they have mild to moderate or to severe, it can depend on their educational achievement, but usually they underscore way below their peers, and they often have a lot of trouble succeeding academically in school. And the next slide is the assessment of individuals with hearing impairments. And so the first bullet point is cognitive assessment, and it is very important that the intellectual assessment of these students with hearing impairments use measures that don't rely primarily on verbal abilities that are like indicators of cognitive functioning. So there are a few nonverbal assessment options considered right for these kids with hearing impairments. So two examples of these are called the Kaufman Assessment Battery for Children and the Wechsler Intelligence Scale for Children. And there are a few other academic achievement tests called the Stanford Achievement Test and the Individual State Achievement Tests. So the Stanford Achievement Test is the only national assessment routinely used to assess the academic performance of students who are deaf or hard of hearing. And fortunately for these kids, the scoring of this instrument incorporates basically normal things based on individuals with hearing impairments. And with the hearing, with the communication assessment part, the language part assessments of these should examine their form of language, the content of language, and the use of language. But some language assessments don't use all of these areas. Some professionals typically use several different assessment tools and techniques like language sampling to accurately determine the individual's language abilities. And speech assessment with this should include a wide range of tools designed to, help and ascertain the individual's articulation, pitch, loudness, quality, and rate. And the analysis of these speech functions will provide a basis for designing speech therapy goals as part of the Individualized Education Program, or IEP, for the student with the hearing impairment. And lastly is the personal and social behavioral assessment. So a number of measures of personal, social, and behavioral functioning are being used with these kids with hearing impairments. The assessment of personal social characteristics with this is very challenging given the language content of most of the measures in this area, which are designed to be completed by a rater in response to items in the domains of social adjustment, self-image, and emotional adjustment. Next slide. And this is my third to last slide, called the educational considerations. So what to look for basically in a school is the educational considerations of the mild hearing loss, moderate hearing loss, and severe. Based on, how you should help these kids, what fits best for them, based on how severe or not the hearing loss is. And so kids with mild hearing loss should have their preferential seating. They might need a hearing aid or a personal FM system. They will probably need repeated instruction from the teacher and possible parent collaboration. With children with mild or with moderate hearing loss, hearing aids can be functional, and they could also use a personal FM system as well, and intervention strategies to help them succeed. And kids with severe hearing loss, they should meet with their audiologist to develop a specialized plan for them in the classroom. And visual language reinforcements, such as teachers standing in front of them so they can possibly read lips, maybe have a number of pictures used to help them figure out what's going on in class, such as the whiteboard or the chalkboard or a smartboard, so they can easily determine what is going on. And according to a recent study, about 90% of these students with hearing loss were enrolled in public schools during the 2013-2014 school year. And before then, in 1975, there's only about 80% of students with hearing impairments were actually in specialized schools. And so these placement decisions in the classroom really depend on the degree of the hearing loss, how old they were when they lost their hearing, how they're able to communicate, if they have any other disabilities, any resources that could be used, etc. And some interventions that could be used are methods of communication, how they can speak, finger spelling, sign language, any auditory approaches, total communication, anything that fits for them. And parents and children should meet with their audiologists frequently to have a specialized plan for them and what is best to help them learn in a classroom setting. And lastly, there are interpreters to be used, people to communicate sign language with them to help them either when they get older and possibly in school, out in the world, if at a job, whatever works for them. And my last slide is strategies for effective teaching and learning. And so these are just individual plans to help the kids best succeed. And so the first suggestion for strategies is promote acceptance of your students. So the student will greatly benefit from a classroom where they feel accepted and where modifications are made without undue attention. So basically, welcome the student to your class, discuss your student's hearing loss with them, and let them know that you're willing to help. And if possible, have an audiologist or another person explain the student's hearing loss to the class so they know what's going on, especially to younger classes that they don't understand very well. And make the modifications you do seem as natural as possible so the student is not signaled out and feels, kind of bummed out about it. And accept your student as an individual and be aware of their assets as well as their limitations. And lastly, encourage the student's special abilities or interests. Suggestion number 2. Be sure hearing aids and other amplification devices are used when recommended. This will enable your student to use their hearing maximally. So you can realize that hearing aids make sounds louder, but not necessarily clearer. Hearing aids don't make hearing normal for the child. Be sure that the student's hearing aids or other devices they use are checked daily to see that they're working. And encourage the student to care for their hearing aid by putting it on, telling the teacher when it is not functioning properly, and etc. And be sure the student always has a spare battery at school, just in case something were to happen. It'd be kind of awful for them to not hear at all, even without a little bit of help. And know who to contact if the device isn't working properly so you can get it fixed right away. Suggestion number 3. Provide preferential seating. So appropriate seating will help your student's ability to hear and understand what is said. Seat the student near basically where you teach, in the front of the room or where your desk is, just so they can see you clearly, if they can read lips. And seat the student where they can watch your face without, straining to look up, or if they have a hard time looking at you, make sure they're right in front of you at all times. And also seat the student away from noise that can interfere with the hearing aids, so forth. And also, if there is a preferred ear that the student would like, place it towards the classroom so they can listen properly. Suggestion number 4, increase visual information. So remember that the student needs to see the teacher's face in order to comprehend and understand what is going on. And try to stay in one place while talking to the class so the student does not have to speech read a moving target, which can be very difficult, especially at different angles. Avoid talking with the face turned downward while reading. This can be especially difficult to read. And keep the light on your face so the student can see accurately facial expressions and possible words. Use visual aids, this is a big one, like pictures and diagrams, which can very much help the student if it's difficult for them to read lips or understand anything that a normal person, a general child would be able to hear. And also use the board, the whiteboard, chalkboard, smartboard, write assignments on it, new vocab words, draw pictures, keywords, and just anything to help them further understand. Suggestion number 5, minimize classroom noise. So even a small amount of noise will make it kind of difficult for the student to hear and understand what is being said. Seat the student away from the noisy parts of the classroom, and wait until all of the students are quiet before talking to them. And the last suggestion, number 6, modify teaching procedures. Modifications will allow the student to benefit from the instruction and will decrease the need for repetition. Be sure the student is watching and listening when you're talking to them. Be sure the student understands what is said by having them repeat the information or answer questions to make sure they know what is going on. Thank you.